So I'm Jason Gleeson. I'm the CEO and founder of Eightwire, and with me here is Justin Lester, who is a director at Loves Data. One of the things around how Eightwire works is we allow the secure and automated sharing of information, and Dot's role as part of that relationship really is bringing in some really innovative access to information, building very smart and clever data products around that information that we're sharing. Healthcare in New Zealand went through a major change in 2020 with the release of the Simpson Report. One of the key findings of the report that they found is that there is a real issue in New Zealand with bringing together the community and healthcare interactions on an individual. So oftentimes the healthcare sector ran as a silo and it was delivering very good health outcomes, but these were being interacted with and influenced by what was also happening in the other areas around it, so mental health, social services, environmental quality, other parts of the sector. In working with Justin, what we're trying to do is bridge those two areas together. So what you'll have is access to the social metrics of what's going on in our communities along with the health metrics at the same time.
I think the report's spot on and that it addresses the need for New Zealand to start to deliver services and health services within the community. Currently we've got a health system which is where hospitals are treating people when they're sick. What we want to do is move that back into a preventative type of system whereby people are being treated at home, they're being treated by telehealth, or not having to be treated at all because they're not becoming ill. They are supported in their communities, they live in resilient communities, they don't have that sense of loneliness or an inability to access service. And I think that's the point that the Simpson Report addresses, and that is the change that they're seeking.
Justin, can you tell me what happens if we don't have the right kind of data?
Yeah, and I think the Simpson Report clearly pointed that out as well. It leads to inequitable outcomes. We know that there are marginalised members of the community who will miss out on health services. They're Māori, they're Pacifica, they're those in high deprivation areas, they're refugees and migrants to New Zealand. They'll be the elderly and also those that have low household incomes and for one reason or another through not owning their own car or not having access to public transport, they just simply don't get treated. So that's something we want to address, and that's something I think the Eightwire system, the Eightwire product can help address by bringing together a whole range of health data sets, from the PHOs to the GPs and medical centres, from the Ministry of Health, not siloed, but easily accessible across the entire country, interchangeable between organisations, and an ability to have that served in real time. So when we're talking about health services and delivery and thinking about the likes of immunisation, I mean, how do you think Eightwire and its products can help the public service deliver better health outcomes?
I think the way that Eightwire can help that really is allowing the transit of that information across many different parts of the immunisation process. It's not just issuing an immunization to someone, it's trying to target and find the people in the communities that need it, especially when you're trying to lift immunization numbers over 80% to you're pushing between 80 and 90%, you actually have to find individuals who are not immunized and bring them into the community and work with them directly. It can't be done through kind of a mass market campaign. And what Eightwire can do is it can allow those organizations or the NGOs that are delivering immunization in our communities to better find the people in the communities that need those immunizations to be done, and allowing as well that information to be driven from a top-down approach. So the teams within the Ministry of Health that are overseeing the general immunization funding and outcomes can actually see where there are communities that need more support and what's actually going on, again, in a near real-time manner. So they're not working off of information that's months out of date. They know exactly where things are happening, and especially with the way immunizations vary by seasonality. So when we have flu season coming through in the wintertime, we need to start those programs in a way that's very agile and rapid to scale up. I think one of the key things that we can address as well is the ability to use analysis to improve things in the future. We live in a very connected world these days, and we have across every part of society, it's very now with Eightwire very straightforward to connect different systems together and in a way work out what needs to be done better. and what can be improved. And it's almost in a position where it's not, there's no excuse to not do better. We have the platforms and tools to do this, and it's the right time to actually kind of rip the Band-Aid off and begin this process of looking at where information is held and how it can be used to, again, drive better quality across the healthcare sector.
I think you're right. I mean, decision makers have that ability to look at the information and the insights they can derive from it in real time. That gives them the ability to support communities better. It gives them the ability to deliver public services in a different way, and to use technologies like online telehealth, for example, with mobile clinics to get out into communities that might not otherwise access services. It's all there, we've just got to use it.
Yeah.
I know that data security and privacy is really important for us at .Loves Data, and that's why we use Eightwire, because we love that it's government audited and you've got the support of a whole range of public service organisations. So how important is that to you?
It's vital. It's the foundation of our entire business. One thing that we've done is we're going to be introducing a layer of transparency around where this information is going and what it's being used for. For years, primary care data has been pushed around the sector in ways that were unauditable. They were just bulk data feeds that were kind of being run with person identifiable information. And so one of the key things that we'll be doing is putting greater transparency around what information is going where, what is person identifiable, what isn't, and who is the ultimate recipients are. At the same time, we're wrapping this in an entire model of governance. So there will be a governing team across all the data feeds that will be accountable for where information is going and ensuring that we meet the standards expected of us by the community.
That's great. So the data will be anonymised, it'll be aggregated, it won't be individually identifiable, it'll be handled securely, but can be utilised to take insights to improve the way decisions are made and public services are delivered.
Exactly, yeah. It's in a way, it's kind of the best of both worlds, because it will be readily accessible but securely handled. And oftentimes in this sector, it's one or the other, or oftentimes the exact opposite. It's hard to get this information and it's not handled very securely. It's just put onto a USB key and walked over to someone and that kind of thing. So we're trying to lift the capability of the sector across the board with this.
Yeah, and that's great.